Dr. Chawla, do you think there is any necessity to panic at this point in time? And do you think that people who got vaccinated a few years ago when COVID was at its zenith, perhaps need to be looking at the vaccine again? Or do you think because of the mild nature of this particular variant, there are precautions necessary, but there is no need for panic?
Frankly speaking, just imagine, just 25 days back, there was no talk of corona at all, COVID-19 at all. Just in last 25 days, when it started in Southeast Asia, particularly Hong Kong, Thailand, and China, then we started seeing cases. First, a bigger number of cases in Kerala, then Maharashtra, then the other states picked up. If you really ask me, people tell me, Doctor, there's an increase of this many 1,000%. So I just tell them one thing. All those cases we have been seeing throughout, perhaps they were all COVID-19 only. COVID-19, what we see now, is largely endemic. We keep forgetting one fact, that before the invent of the big pandemic in 2020 and 21, the people used to fall in the same cough and cold, the same headache and feverish condition. We used to always feel it this way. They were cases of influenza. So I feel all this reaction now, overreaction, I would say, over response, I would say, is absolutely unwarranted. This is simple corona. Even in my own OPD, when I see, for example, 50 patients, and after 50, if I feel around 35 to 40 are a simple flu-like condition, and I ask them, do get tested corona? They said, Doctor, it gets all right so easily, why get tested? So the increase in number of cases we see because of more testing, and further increase we don't see because the testing is not being done that extensively, because most cases are simple and easily can be treated by simple isolation, no antibiotics, simple paracetamol, 4-5 days of rest, better hydration, good nutritious food, and it is all over. All the hula and the noise about it is the 55 deaths out of a patient of hardly 5.5 thousand. Imagine out of a population of 140 crore. So it is already exaggerated. So I would not say that we should not bother or we should not take precautions. Precautions, yes. Panickiness, not at all. And I would again repeat to all the viewers of yours, the simple corona protocol of using a mask when you go out. Number one, hand hygiene, either by soap and water wash or sanitization, and do not overcrowd and go to crowded places, and look after your nutrition. As far as the controversy of immunization is concerned, the immunization has already faced a lot of controversies, that all the excess heart attacks, all the excess strokes are being caused by the vaccination? My answer is perhaps yes and perhaps no also. So this for two vaccines, Covaxin and Covishield, they were approved for emergency use only. They were not extensively tried. There is no question of taking another shot at all. But I must tell the viewers, because of the large number of people having taken the vaccination, plus large number of people having suffered the subclinical infection, we have got a herd immunity. I personally feel we Indians as a society, as a class, as a nationality are protected, and we have nothing much to worry. So as we used to bother less about simple flu.
Right, sir.
Don't forget this much of mortality was there when the flu was also there in before 1920. The same should happen now. So no reactions, simple precautions.
That's a good point to make. That's a good point to make. Dr.